The heart stops beating, the brain gets blocked. One person suddenly collapses, another wakes up paralyzed on one side. We have seen those horrifying scenes too many times. But have you ever asked yourself, what is the true root cause of those sudden tragedies? Did you know, right at this moment, there might be a time bomb silently counting down inside your body? It causes no pain, it makes no ticking sound, and for that very reason, it is all the more dangerous. When it explodes in the heart, that is a heart attack. When it explodes in the brain, that is a stroke. A shocking study in the United States shows that more than 70% of people over 60 are living with this bomb without even knowing it. They only feel a little tired, a little dizzy, a slight headache. Then one day, they collapse or wake up unable to speak, unable to walk. The truth is, a stroke and a heart attack are not two different diseases. They are two different endings of the same root enemy, which is destroying the vascular system in your heart and brain day by day. And if you don't know its name, don't understand its mechanism of action, then you are just like them living with a killer without any defense. This video will help you unmask the identity of that enemy and show you how to neutralize it before it has a chance to take everything away. When you hear about a stroke or a heart attack, you might immediately think of high blood pressure, high cholesterol, or diabetes. I understand. Those are the things that always show up on routine lab reports. But did you know? All those numbers are merely outward symptoms. What is truly concerning is the root cause inside your blood vessels silently developing every day. The first root cause is chronic inflammation. Inflammation occurs when the blood vessels are continuously damaged by high blood sugar stress toxins or even dietary habits. It doesn't cause pain, it doesn't cause a fever, but it weakens the lining of your blood vessels day by day. To patch things up, your body accumulates cholesterol and minerals right at the site of the injury. The result is the formation of atherosclerotic plaque. At first, this plaque acts like a protective layer, but over time it becomes thicker and more brittle, prone to rupturing at any moment. When the atherosclerotic plaque ruptures, the body reacts as if to an injury. It immediately forms a blood clot to seal it off. And it is that very blood clot, if located in the heart, that will cause a myocardial infarction. If it travels to the brain, it will cause an ischemic stroke. You don't have any symptoms yet. That doesn't mean you are safe. In many cases, I have encountered people felt completely healthy until the blood clot appeared at the worst possible moment. Furthermore, there is a special condition called atrial fibrillation. This is when your heart beats irregularly, causing blood to pool in the heart's chambers. When blood is not pumped out completely, a blood clot can easily form, and if it travels to the brain, a stroke can occur even while you are sleeping. And finally, there are triggers, such as stress insomnia infections, extreme heat. If your vascular system is already weakened, just one difficult night's sleep, one instance of strong emotion can be enough to cause a disaster. You see, the problem isn't just about blood pressure or blood sugar. It lies in the state of inflammation in the plaques that are on the verge of rupturing and in factors you might think are minor, but have enough power to trigger a stroke or a heart attack in an instant. And that is why I am here. Not to scare you, but to help you look deeper, understand better, and be more proactive in protecting yourself. Because there are dangers silently existing within your body, even when you feel completely healthy. You may have heard of inflammation as a normal response of the body to injury or infection, for example, swelling, heat redness, or pain. But there is another type of inflammation more silent, more dangerous, and you could be carrying it within you without being aware of it at all. It doesn't cause a fever, it causes no pain. There are no obvious signs on your body, but every day it is silently damaging the walls of your blood vessels. Doctors call it chronic inflammation within the blood vessels, a process that unfolds quietly beneath the surface, yet it is the beginning of major events like a stroke or a heart attack. The problem begins with the endothelium, the inner lining of the blood vessels which normally functions as a shield. But under the constant impact of seemingly harmless factors like high blood sugar, bad cholesterol, smoking, stress, lack of sleep, or simply sitting for too long with little physical activity, that endothelial layer begins to crack and become inflamed. When this protective layer is breached, the blood vessels become leaky, allowing cholesterol and other inflammatory molecules to seep in, adhere, and accumulate, forming the first atherosclerotic plaques. And the dangerous part is this. This process causes no symptoms whatsoever. It happens silently for many years until one day you collapse from a heart attack or a stroke, and only then does someone discover inflammation had been present in your body for a very long time. As a doctor, what concerns me most is not the numbers on a lab report, but the silent damage occurring inside the blood vessels. If you only look at blood pressure or cholesterol, you are looking at the symptom. But the root cause is inflammation. And if you don't control it from the root, all other efforts are merely temporary. Have you ever wondered, what does prolonged chronic inflammation lead to? The answer is something I see every day when looking at angiograms: atherosclerosis. This is the direct consequence of your blood vessels being inflamed over a long period. When the endothelium is damaged, the body does not remain silent. It tries to repair it. And one of those methods is to send cholesterol, dead cells, and calcium to patch up the inflamed area. The problem is, these patches don't disappear. They continue to thicken over time, silently clinging to the vessel walls. Starting as a thin layer, they grow larger, taking up space within the vessel and making it difficult for blood to flow. A person may not notice anything for years, no dizziness, no chest pain, until the vessel becomes excessively narrow or completely blocked. But the greatest danger does not lie in how large or small the plaque is. The greatest danger is when it ruptures. When that happens, the body thinks it is dealing with a real injury and immediately forms a blood clot on the spot. And it is that blood clot, not the plaque itself, that directly obstructs blood flow. That is the moment when blood cannot get to the brain or the heart. And that is also the moment a stroke or a heart attack occurs suddenly without warning. Many of my patients have cholesterol levels that aren't excessively high and blood pressure that is only slightly elevated, but when their blood vessels are examined, they are found to be severely narrowed. Atherosclerosis is not loud. It does not cause you pain, but it turns your blood vessels from a smooth river into a rough and progressively narrowing pipe. And when it ruptures, the consequences are no longer theoretical. Have you ever asked yourself, why can a person who is walking normally and speaking clearly just minutes later become unable to move or suffer a severe heart attack? I have witnessed it, and the cause very often is something smaller than a grain of rice, a blood clot. A blood clot is a solidified mass of blood, but it is not something foreign to the body. When you cut your hand, your body forms a blood clot to stop the bleeding. That is a survival response. But the danger arises when a blood clot appears at the wrong time in the wrong place, right inside a normally circulating blood vessel. There are two ways these dangerous blood clots form. First, when an atherosclerotic plaque within a blood vessel ruptures, the body thinks it is injured. It immediately dispatches platelets and fibrin to patch up the rupture. But this very reaction creates a thick, sticky mass of blood that clings to the vessel wall, forming a local blood clot. Second, if you have atrial fibrillation, meaning an irregular heartbeat, blood is not pumped out completely and pools in the heart's chambers. In that environment, blood clots very easily. Once a blood clot has formed in the heart, it can travel with the bloodstream and get stuck anywhere, usually in the brain or the coronary arteries of the heart. The consequence of a blood clot occurs in an instant. If it blocks a blood vessel in the heart, your heart doesn't receive enough blood and oxygen, causing a myocardial infarction. If it travels to the brain cells stop functioning due to a lack of oxygen, causing an ischemic stroke. In both cases, every passing minute means life is slipping away. I often tell my patients inflammation, atherosclerosis, high blood pressure, they are all just the foundation. But the blood clot is the real bullet. It gives no warning. It doesn't need time to accumulate. It only needs a moment to change an entire life. And the most difficult part is by the time you feel the symptoms, it is often too late to stop it. That is why I always emphasize if you want to prevent a stroke or a heart attack, you must start before any blood clot has formed. There are dangerous things that cause no pain, no fatigue, and won't put you in the hospital immediately, yet they have the power to land you in the emergency room within minutes. Atrial fibrillation is one of them. Atrial fibrillation is a common type of heart rhythm disorder, particularly in people over 60. Normally, your heart beats in a regular cycle. The atria contract rhythmically to push blood down to the ventricles, which then pump it throughout the body. But in atrial fibrillation, the atrial chambers beat rapidly and without any order. Blood is not pumped out completely and begins to pool in the atria. When blood stagnates, it becomes the ideal environment for blood clots to form. And what worries me most is that this blood clot does not stay put. It can suddenly travel to the brain, block a cerebral artery, and cause an embolic stroke. No warning, no early symptoms, just one slight slip, and you could lose the ability to speak, become paralyzed on one side, or even lose consciousness entirely. I have met many patients who came for a checkup only because they felt their heart beating a little fast or felt slightly short of breath when walking. After an electrocardiogram, we discovered atrial fibrillation. Fortunately, they discovered it early. But many others who feel nothing until the stroke occurs. And by then, sometimes all efforts are too late. The frightening thing about atrial fibrillation is it is not painful. It is not obvious, and no one thinks they could have it. But according to research, people over 60 have a much higher risk of atrial fibrillation, and if left uncontrolled, their risk of stroke increases 5-fold compared to those without the condition. Atrial fibrillation is a silent killer. It doesn't cause panic right now, but it is the starting point for the most severe adverse events I have ever witnessed. And it is completely controllable if you are diagnosed in time and treated correctly. I have often heard people say, "Doctor, just yesterday my loved one was still walking, still eating normally, but this morning they had a stroke. Why was it so sudden?" And the answer often lies in the small things we rarely pay attention to the triggers. When the vascular system is already compromised by inflammation, by atherosclerosis, by an arrhythmia, it can still exist silently for many years without causing an event. But it only takes one small impact at the right moment, and everything can collapse in minutes. I call it the drop that overflows the cup. It could be a night of persistent insomnia, causing blood pressure to fluctuate abnormally. A hot day causing the body to dehydrate, making the blood thicken and harder to circulate. A burst of anger that increases adrenaline, causing the heart to pound and vessels to constrict suddenly. Or simply a case of the flu, which can also increase systemic inflammation, activating the blood clotting mechanism. These factors, which seem temporary, have the potential to accelerate the formation of a blood clot, turning a plaque that was lying dormant into an explosive point that causes a blockage. And once the blood flow is blocked, whether to the brain or to the heart, the consequences will come very quickly and very severely. Some people feel dizzy just from climbing a few stairs in the hot, humid noon. Some feel a crushing chest pain right after hearing bad news from their family. The problem doesn't come from the action, but from the fact that the blood vessels were already extremely fragile beforehand, and it only took one final touch for everything to collapse. You can control this. No one can avoid stress completely, but you can learn to reduce tension, get enough sleep, drink enough water, and listen to your body. Because sometimes preventing a stroke isn't about medicine, it's about how you live day by day. When you look back at the entire process from inflammation to atherosclerosis, then blood clots and blockages, you will see a stroke or a heart attack is not a sudden accident. It is the result of a chain of biological reactions taking place every day in your blood vessels, sometimes lasting for decades without you even knowing. The unfortunate part is that most people only realize it after the event has already occurred. But you are different. You are seeing the whole picture before it closes. And therefore, you have the opportunity to start early before there is any clear damage while the blood is still flowing normally. Do not wait for symptoms to act, because by then, your body no longer needs a warning, it needs emergency care. But right now, you still have time. And if you just start today, what is silently happening can be stopped right here. Thank you for taking the time to listen. If you have watched this far, it shows me that you truly care about your own health, and that is the most important first step. Remember, what you have learned today is not meant to cause fear, but to empower you to be proactive. Blood vessels cannot speak, but if you take care of them properly, they will silently protect you for a lifetime. I hope that this knowledge will help you make better decisions, live with more peace of mind, not just for yourself, but also for those you love. I look forward to seeing you in the next video, where I will share more specific solutions to protect your heart, your brain, and the very blood that nourishes you each day. Wishing you continued health.